I'd like to introduce our two speakers today, and I really just want to start by saying thank you because I know we're appreciative of your time and this is outside your normal work hours. I'm actually privileged to work with both Lauren and Maddie in my work day as well. I do have experience working with both, and they are very dedicated to improving the outcomes of families with complex conditions. First of all, I'll introduce Dr. Lauren Collada. She's a research fellow at the University of New South Wales and also at Sydney Children's Hospital. Her research focus is on improving healthcare and mental health outcomes for children with rare and chronic illnesses and their family members. She collaborates with interdisciplinary teams and works closely with family advocates and the community sector to implement and evaluate healthcare innovations and psychosocial interventions to ensure families are not just surviving, but thriving. Maddison Smith is currently doing a PhD with the Faculty of Medicine and Health at UNSW. She graduated with a Bachelor of Psychology with honours in 2023 and earned the University Medal for her research on fear of recurrence and progression in cancer survivors. Maddison began working as a research officer at St Vincent's Hospital in Sydney in 2024. In this role, she collaborates with allied health clinicians to research psychosocial impacts of stroke and how to develop more equitable models of care in hospital settings and how to advance stroke rehabilitation. Maddison is compassionate about communicating how psychology and mental health should be embedded in clinical care across the healthcare system for both patients and families. Her PhD is focused on how to support psychosocial wellbeing of siblings of patients with developmental and epileptic encephalopathies. So we're really grateful to be working on that with you as well. And with that, I'll hand over to you. And as I said, we'll keep any questions till the end. I think I've hit record. Yes, I have. All right. Over to you. Thank you so much.
Okay, great. Thank you, Priya. Hi, everyone. Thank you for having us here today. I've been working in the sibling space since about 2018. It's something I feel very passionate about. I always love talking about siblings and raising awareness of sibling wellbeing. I'm really happy to be here today. So thrilled that Maddie able to do her PhD focusing on sibling wellbeing. We're really excited with what we're able to offer in terms of support going forward. In my work and from colleagues around the world, we see that siblings can have a range of negative experiences. So this is things like they can feel forgotten, they can feel jealous, they can feel guilty, they can act out in the family, also at school and in the community. They can feel great sadness, anger, and experience distress and anxiety. Some preliminary data shows that their experiences of anxiety, distress may be higher than siblings of children with other chronic health conditions. And that those negative mental health experiences have the potential to persist into adolescence and adulthood. While there are these negative experiences, it's also important to say that siblings can also experience greater empathy than their peers. They show great maturity, and many siblings in interviews and the literature describe really beautiful relationships with their affected brother or sister. So I think it's important to keep those things in mind as well. And then siblings have many unanswered questions. So siblings are very aware of the immense stress that their parents are under, and they don't want to contribute to that stress. And so they may have questions about the condition or about what the future is going to look like. They might have questions about caregiving roles or their own mental health or just concerns in general. But they also might be holding on to all of those things, trying to protect their parents. So what I want to do is give some hopefully helpful strategies for how to better support siblings. The strategies I'm going to offer, take what works for you and leave the rest. These are general strategies that I've pulled together from my work with siblings and families, as well as the clinical psychology, youth mental health literature. Take what works and then ignore the rest. I'm going to talk about strategies for talking about difficult medical things with young people. And I'll talk about different strategies for speaking with children versus adolescents and young adults. I'm going to touch on processing trauma and where to go for help and what kind of mental health services to look for if siblings need professional assistance. How to talk to siblings about maintaining their mental health, just checking in with the sibling. I'm very briefly going to give some suggestions from teenagers themselves who've given helpful quotes or opening phrases that parents can use. Then I'm going to signpost some resources and supports, and that's where Maddie's going to talk a bit about her PhD. Okay, so starting with communication about medical things. These are really complex conditions and no one has all the answers about them. For siblings, this can be really confusing and overwhelming. They may have lots of questions. They may be reluctant to initiate conversations. This is especially true for boys. As a parent, you might like to ask your child's unaffected children how informed they would like to be. You empower the sibling by allowing them to set the limits, the pace and direction of those conversations. It's a really good idea to start those kind of conversations by asking them to explain to you what their understanding of the condition is. You might find that they've misunderstood some things or cobbled together bits of information and come to the wrong conclusion. You also might be surprised by how much they actually do know. They may have been overhearing conversations and looked things up online, and they've actually formed a pretty good understanding. Good to get a baseline understanding before you can then proceed with more in-depth conversations. You don't need to know all the answers. It's okay to say you don't know. There is a lot of uncertainty and unpredictability with DEEs in general. So it's okay to say you don't know. And sometimes you might want to look up information together if that's appropriate. Other times you might want to ask a mental health professional or one of the doctors and encourage that information seeking with the sibling. With those communications around medical things, if they have questions about seizures or some of their multimorbidities or how often they need to go to the doctors or can I come along to one of the appointments so I can understand better, you're wanting to encourage them to share their concerns and respect their perspective. So this is just general advice, and I'm going to now break it down for children versus adolescents and young adults. For young siblings, there are two common misconceptions that children of young people with rare epilepsies, but chronic conditions in general can have. They can have a misconception that they can catch it, and they can have a misconception that they've caused it. And so this is where getting them to explain their understanding of the condition can be really helpful because it can help weed out these issues. So for children, they might think they've had a bad thought about their brother or sister, and then their brother or sister has a seizure. So in their mind, that's connected, and they believe that they've caused it. And that can be a great source of anxiety for them. But they don't talk about it to anyone because there's a lot of shame associated with that. So you initiating those conversations and asking them their understanding and probing them for any questions or concerns can help weed out those misconceptions. As an example of how terminology can complicate things for children, I was working with a child of a young person with cancer, a few years ago, it became clear that he was confused about something. He said that he understood that cancer wasn't contagious, but he had heard people talk about cancer spreading. And so isn't that the same as it being contagious? And if you think about it, that's a very reasonable conclusion that he had come to, because in the early days of the pandemic, we were talking about stopping the spread of a contagious disease. For us as adults, we understand that a word like spread can mean a different thing in different contexts. But for children, they're very literal brain. And so they don't understand those nuances with language unless someone teaches it to them directly. That's just an example of how children can come up with the wrong conclusion by piecing together bits and pieces of information. When you're talking with children, so the young siblings, it is very confronting to use terms like death. That's your choice about whether or not you go into those conversations. If you do, though, it is best to use the real terminology. Because if you're using a metaphor for terminology, go to sleep or pass away, children's literal brains can misinterpret. There are times when people go to sleep and they just don't wake up. And there have been many instances in the literature of people describing children who develop a fear of sleep because of that. So using the real terms is helpful. Where metaphors can also be helpful is when you're using a metaphor to describe a process or a concept. So I've given an example here of a metaphor of a light switch going on and off to explain a seizure. You would still use the term seizure, because otherwise they're going to hear these terms and they'll come up with their own explanation if the explanation isn't given to them. But then you're pairing that with a developmentally appropriate metaphor to help explain a really complex process. For adolescents and young adults, they might have questions they would like to pose to one of the doctors. You might ask them to write down a question and then take it to a doctor on their behalf. If they come along to an appointment, give them the opportunity to actually ask their question in person. That's helping to empower the young person and also making sure that they're getting verified information. In terms of looking up information online, they're going to do it. And I don't know if just telling them to not is the best way to do it, but maybe if you help them find the verified information. So help them when they're going to Google something to look up the sources. As a general rule of thumb, if it has a .org or a .gov URL, then it's generally more trustworthy than just a .com. Also, children are using AI increasingly, helping them use AI to follow back the sources to make sure those sources are actually real and that they are also verified information. It's not just something that the AI has made up. Working with them, and so you're on a team together, can be really useful. And you can sit at a computer together and look up information, because some of their questions might also be some questions that you have, helping them find information that's going to be helpful and not too overwhelming. But then that goes back to that earlier conversation that you would have already had about figure out what their level of information that they want to have. Okay, medical trauma can be bearing witness to seizures and many seizures. It can be other things as well, but that's generally a relevant one for the siblings. It's generally unhelpful to try to process the trauma while the child or adolescent is still in a heightened state emotionally. You want to give them a chance to regulate their emotions, and that helps them to develop good emotion regulation strategies over time. It's letting them know that you're available to talk whenever they're ready to. And then when you do have those conversations, you want to focus on what they felt and what their concerns for the future are. You don't want to focus on restating what they saw. So for trauma-informed practices in psychology, you generally don't go into detail about what happened. You go into detail about what did you feel and then the consequences that has had on you personally. In terms of psychological support, I don't know of any psychologists who specialize in sibling mental health. So I wanted to give you some strategies to find a psychologist and what to look for when you're looking for a psychologist. So you have some psychologists who specialize in trauma, but generally that's one inciting incident, surviving a natural disaster, and focusing on how to process that one incident. With siblings, they may have been exposed to multiple traumas and will continue to be. If there are seizures continuing or multiple hospitalizations or scary things, like anything medical can be really overwhelming for young people. If you feel professional psychological help would be good for the sibling, you want to find someone who has expertise in complex trauma. So these specialists understand and apply psychological services for trauma that is ongoing or has happened multiple times. In terms of therapies, cognitive behavioral therapy is probably the most studied. There's a lot of evidence to show it works very well for youth exposed to trauma. So cognitive behavioral therapy, or CBT, it's about developing emotion regulation strategies and coping strategies. So it's helping the young person develop their internal resources so that they can develop resilience. Then they have those skills when they're faced with hardship going forward in their life. There are other trauma therapies as well. So eye movement desensitization and reprocessing. This is an example of where the psychologist may move their finger around and the sibling follows the finger just with their eyes, while at the same time they're thinking about the emotions attached to a trauma they've experienced. And the idea is that you are separating the feelings from the actual memory so that you can remember that trauma without having an overwhelming emotional response to it in the future. So separating the emotions from the memories, really effective, better than trying to just suppress bad memories, because that sort of suppression can lead to worse outcomes in the future. Talking with siblings about maintaining good mental health, you want to explore and validate their feelings and challenge. Similar to conversations about medical things, young people are very reluctant to initiate conversations about mental health. So it's nice if you as a parent are able to initiate that conversation, just checking in with them, asking them how they're feeling without telling them how they're feeling. Sometimes siblings or young people in general have difficulty explaining or describing their emotional experience. So you can offer a suggestion like, I would understand if you were feeling resentful. Is that how you're feeling? Without actually telling them how they feel. Once you get past that, you wanting to open up the conversation to more open-ended questions just to explore their internal world and show curiosity for their experiences. Showing of curiosity can be a huge thing in and of itself, even if you feel like the conversation hasn't been all that successful or hasn't gone anywhere. Just giving your child that one-on-one time, they really value that. For children, play is really important. So making sure they have the chance and space to play so they're able to regulate their emotions and reduce stress. If you're able to, play with them, that's great, but it's not always possible. Just making sure they've got time on their own to play. For adolescent siblings, adolescents in general, that's the time when young people start looking from the family to outside to their friendships for social support. So making sure that they have that chance for connection. If they or you feel like they don't have those solid connections, I'm going to give some resources where they can potentially connect with other siblings. These were some suggestions from teens. Maddie and I spoke to the youth council at Sydney Children's Hospital a few weeks ago, and these were some suggestions they had for parents to make them feel heard. Their suggestions were encourage questions, use active listening, show accountability and apologize where appropriate, show empathy, let them know it's hard sometimes and that your experiences can be really difficult. And I see that. And then that last one is just an example of active listening. So you're saying you feel left out sometimes when we focus on your siblings' health, just repeating back to them what they've said to show that you really are listening. Before I move to resources, these are just some things I wanted to keep in mind. Many siblings do experience symptoms of anxiety and distress. At the same time, they will also develop skills for resilience. And many siblings will face challenges greater than their peers. And at the same time, they're developing empathy and maturity. So just important things to keep in mind. We're having a strength-based approach to sibling wellbeing. And then a subgroup of siblings will have persistent mental health problems. If you and your child think that professional help is necessary, there are lots of psychologists and therapists who are available, who specialize in complex trauma, who offer CBT or other therapies that might be appropriate. You get a Medicare rebate for those. It's also really important to shop around with psychologists until you find someone that your young person really likes and feels they can be open with. Don't settle for the first one. Keep looking until you find someone who you click with. And these are the resources that I promised. I will share the slides. There's links to all of these resources. The first is responses to trauma. If you're interested in learning more about trauma in young people, Emerging Minds provides great resources and tips and strategies as well for trauma, but a lot of other mental health experiences for young people. BetterHelp offers tips and strategies as well. Emerging Minds also has strategies for speaking about your child's well-being to the school, either to teachers or school mental health staff. And that can be either initiated by you or initiated by the school. This is the resource I mentioned earlier about connecting siblings with other siblings. Siblings Australia, if you're not aware, is the leading sibling advocacy group in the country. They are focused on siblings of patients with a disability and offer quite a few services for different ages. This one, connecting siblings with other siblings, is for teens and adults. You can take a look at that and see if there's meetups or WhatsApp groups that siblings can join. Sibs Online is Maddie's PhD, so this is also an opportunity for siblings to meet other siblings and connect and validate each other's experiences. So she's going to talk about that in a minute. All of these are also Siblings Australia. So we have, if siblings are concerned about their caregiving role in the future, so SIB Plan offer practical information. Navigating real life challenges. There's lots of resources from the SibWise program. And the mental health support, this one is actually interactive. This is individual or family counselling. It can be online or face-to-face if you are in South Australia. This one does have fees associated with them, but you connect with a counsellor who has expertise in sibling wellbeing. A great resource if it's available to you. And then these were just a couple ones that I thought might be useful. When we're talking about adolescent mental health, I think it's important to signpost self-injury and self-harm. This may be an issue, it may not be. I actually did my PhD in self-injury, so if anyone has any questions about that, I'm more than happy to talk about that in detail. A colleague of mine at Cornell University has developed a range of resources for young people who self-injure, for parents, and for school. And there's a lot of resources around what recovery can look like. So you can visit their Cornell website. And then just in terms of if the young person with D is showing aggression toward the sibling, this can be a really tricky situation and really difficult to manage and navigate. I just wanted to offer this resource from the Intellectual Disability Health Education. So they provided a e-learning service about mental health for young people with intellectual disability, and that included managing aggressive behaviors. That was everything that I had. Maddie, unless there are any burning questions, I can hand over to Maddie to talk about SIBS Online.
I'll just wait to see if there's any questions. No, doesn't look like it. Thanks, Lauren. That was really interesting. As Chris said, I'm doing my PhD in sibling support, specifically siblings of patients with DEEs. And part of my program is doing a pilot study of SIBS Online, which is an online psychosocial program that was developed in Norway a few years ago. And the program is designed for siblings of patients with rare diseases. It's completely online, a 6-week program, and it's a group-based program as well. So it gives, like Lauren said, the opportunity for siblings to connect with their peers and also for parents to connect with other parents. It was originally developed as a face-to-face program called SIBS, where siblings and parents would come together in a group session over 2 days or 6 weeks. This worked really well in Norway. They did a randomized control trial, which is the highest quality trial you can do in research, and they found promising results about this face-to-face intervention. But they wanted to make it more accessible for families who were geographically isolated, maybe can't travel hours and hours to have a face-to-face program, wouldn't have the time to be able to do that as well, even if they are living in a metropolitan area. That's why SIBS Online was born, to make this program more accessible. The main aim of the program is to improve parent-sibling communication, which, like Lauren outlined, is really important, and it can often be hard for siblings to initiate those conversations. It can be hard for parents as well to initiate those conversations. It gives siblings and parents that structured environment to begin having conversations that they can then take beyond the program. Hopefully, by improving communication, it also improves sibling and parent mental health as well. That would be a main goal as well. It equips parents with the skills to communicate with their child, and one part of the session is about their brother or sister's condition, so talking about what the sibling knows about the condition, any questions they might have, any concerns they might have. Another part is talking about broader challenges that siblings might be facing. This can be things going on at school, with their friends, at home, not condition specific. It also provides peer support, a space and a community to connect with other siblings and discuss any questions they have and have their emotions and feelings validated. Next slide, please, Lauren. This is an outline of what the program looks like. The blue boxes are sessions where siblings are with their other siblings and parents are with the other parents. The yellow boxes are where the parent and the sibling will come together and have a joint session. So session 1 is just an introductory session where siblings and parents will get to know the others in their session, and there's around 5 to 6 other sibling-parent pairs in each session, and ask any questions about the intervention. In session 2, this is about exploring the diagnosis and the condition, and siblings in their group will discuss potential questions that they have wanted to ask their parent, or they might hear something from another sibling and they think, oh, I haven't thought about that before, and just have a really productive discussion that they may not have had before in this peer support environment. And then parents will be talking about how they can support siblings in answering these questions, or, as Lauren said, you're not going to have all of the answers all at once, potentially going and researching with the sibling or just strategies to help them really get an understanding of the condition and the diagnosis. This ideally will happen, the sibling session will go first, and then the parent session will occur after the sibling session, so we can bring the sibling questions to the parent session, which gives parents a little bit more time to prepare for what their child might ask them. And then in the joint session, we bring siblings and parents together. Siblings and parents will go into breakout rooms and practice this communication with one another. It might feel a little bit unnatural at first because a lot of the strategies given might feel like therapy talk. So it might feel unnatural at first, but the point is just to be learning how to have these discussions and conversations and eventually build them naturally into your conversation. And then session 4 and 5 are very similar to what I just spoke about, except they're focused on broader emotional experiences. So not condition specific. This is just about challenges and emotions that siblings might be experiencing. These sessions are all facilitated by 2 to 3 group leaders, and they'll pop in and out of those breakout rooms to help just to observe and help conversation along if required. And then the final session is a joint session, which just brings everyone together to recap what has been learnt and also give siblings and parents the opportunity to provide feedback to us as well. Thanks, Lauren. Next slide. So this is the first pilot study of SIBS online in Australia. It's currently only available in Norway outside of a research setting, but they've had such great success and uptake with it that they're running pilot studies in a few different countries now: Cambodia, United Kingdom, the United States, and Australia. And we're focusing on siblings of patients with DEEs, but the goal would be to roll this out for rare disease families broadly. So our pilot studies hopefully beginning in March next year, if all goes well. And while it's not accessible to the public yet, we hope promising results of this study will allow us to implement it into a care pathway. We've had interest from the Rare Care Centre in Western Australia, which are a really good coordinated service for rare diseases. They have expressed interest in both the face-to-face version and the online version of SIBS. And also, like Lauren said, Siblings Australia is the only nationwide organisation focused on siblings. There's opportunity there as well to potentially embed the program. That's all from me.
First of all, thank you. What I took away was really informative. I'm reflecting. My sibling is nearly 24 now. I think maybe I tried some of those things on my own, but I'm not sure how successful I was. So I think the fact that you've done the research, Lauren, and know that some of these successful approaches will help us in the here and now. So I just wanted to see if anyone wanted to ask any questions or clarify anything. I know people are juggling things in the background. I think we're all quiet. Oh,
Hello.
hi, Emily.
Emily and Neil here. I had a question around the SIBS online, what the target age bracket is for siblings, and sorry if I missed that.
No, I should have clarified that as well, sorry. For my project, we're looking at adolescents. So we're looking at 12 to 18 years. In Norway, they did pilot it though from 8 years and up. So there's definitely opportunity if we do end up implementing it to have quite a broad range. But it works best when siblings of similar ages come together rather than having a 14-year-old and an 8-year-old in the same session. So that's why we've condensed it to adolescents.
Yeah, makes sense.
Are there any resources geared towards having conversations with younger children?
Our sibling is a 4-year-old.
In terms of resources, you can look at Siblings Australia working purely with adults, but over the years, they've increased the age range that they're supporting. So you can take a look to see if there are any resources there. But then I think also there are some US-based sibling places. I'll need to think of the names and I can send that maybe with the recording that goes out. There are definitely resources available, but it is just about taking a developmental lens, knowing your child more than anyone, knowing the words to use to help explain things to them and how it's going to be explained. Just having that age-appropriate developmental lens is key.
When you said you never really know how much your child understands, and asking them is really important. Our little guy has epilepsy and a physical disability and needed surgery on his feet. In conversation, it was revealed that his sister explained it to me, her preschool teacher. Effie's having surgery because he has epilepsy in his feet. Which was very sweet, but we obviously hadn't explained it that way.
Yeah.
She just thought that was the way it worked.
It's so common and it is really sweet the way their minds work. Sometimes the conclusions they come to can be harmless, but then sometimes it can be, like they've caused something. So it's just about asking them, starting the conversation by asking them, what's your understanding? Can you explain it to me? And then that helps give you a baseline of where to start.
Yeah, that was really helpful. Thank you.
If there's no other questions, we will thank our speakers, Lauren and Maddison, for giving up their time and sharing their knowledge and letting us know about SIBS Online. We have a parent in our community that's involved in that, so making sure that we have that lived experience involved in that project. So working alongside Maddison as she develops and works that through all the right processes before we kick off next year. We'll definitely keep everyone informed, keep in mind any resources for that younger age group. I'm thinking there's some other disability groups that have a lot of resources, so I'll check that out. When we send out the recording and resources that Lauren shared, we'll put them in there and get them onto our website as well.
Can I jump in quickly, Chris? I am muted. I'm sorry. I'm laying down with Jacob. Emily, in regards to resources for your 4-year-old, my youngest is 5 years old and she's grown up with Jacob having his disability, but we've found a lot of resources for her, which are age appropriate picture books. There's quite a lot out there that our palliative care team have shared with us as well. So if you want, I can always find the good ones that are in our bookshelf and send a list through to Chris to pass on to you if you wish to.
Well, thank you. That would be great. We have found a few books which have been helpful. We've actually got one from the library right now. When Charlie Met Emma. I don't know if that's in your bookshelf, but that's very...
Loving my daughter's name is Emily.
Yeah. Wheelchair with limb differences. It explains how different is different and not real strange. And it's good.
Oh, lovely. I'll get a list together for you.
Yeah, thank you. Just another quick question. Lauren and Maddison, is there anything in the research on whether an older or younger sibling has a different obviously they would have a different experience, but whether that comes out in the research in any statistically noticeable way?
It's more about how they express that experience. For young children, it can be acting out a little bit. Naughty behavior can actually be tied back to experiencing anxiety. They're just not able to express it any other way. Whereas for adolescents, they most of the research that's looked into mental health of siblings has focused on adolescents, and that can be more internalizing experiences. That's where you start to see things like anxiety and depression symptoms. There's definitely a lack of research on very young siblings.
And yeah, I think just what Katie said, whether a sibling has always grown up with an older sibling that has a DE, or whether if there's an age gap and they're the older sibling, makes a difference. Where it's always a kind of normal if they're a younger sibling, or if an older sibling remembers a different experience.
Yeah, so I don't have any data on age order, but I do have, compared to siblings of children with cancer, where there's a very clear onset of the disease. Their experiences are very different. Families of children with cancer describe it as this big catastrophic event, but at the same time, there's an end point to that. And then they're returning to a new normal afterwards. Their experiences are very much like this. Whereas for siblings of children or young people with a disability or genetic conditions that they've always lived with, it is less of that catastrophic experience. And for some, they're just like, yeah, this is just life. That's just how they are, and never really thought about it until maybe they got to school or high school and they started to compare themselves to other families. But the conditions can change, and that's where you start to see maybe more anxiety if there's like a onset of seizures that are really distressing for everyone. In comparison, it is like a very different experience. And I think that is also part of where the siblings of young people with disabilities can show greater empathy, because they're just so used to people having different abilities and that's so normal to them. So there's kind of benefits to it as well.
I asked Lauren, like you said, that most of the research has been done in older adolescents. Is that largely in getting like ethical approval, or because I guess in my mind, the earlier we can intervene or work on how we interact, and yeah, I don't know, it just seems logical to be able to work with, I guess, as young as makes sense.
Yeah, you're definitely right. The big thing is working with children requires a lot more expertise and speciality. The ways that you would go about even talking to a child or trying to gather data from a child is so different, and it requires a lot of experience working with children. Whereas with adolescents, you can do an interview with them, you can give them a questionnaire to fill out. It is a lot more straightforward. So I think that is the big, and then as you mentioned, ethics approvals is also a bit of a hurdle. But yeah, there are researchers around the world. Our team in Norway, they're all child psychologists, so this is their big area as well. So there are people who are working on it, but it's just fewer.
Yeah. Okay. Thank you. All right. Any other questions, comments? I will gather everything that people have kindly shared. I've got a couple of books that are parent related as well. If they haven't been added, I'll also add those. But yeah, just want to thank our speakers, but also those who made time to come today. And we will make this available. It'll probably be early next week, if I'm being honest. Thanks for joining us. And if you do have questions, please send them through. We can follow up with Maddison or Lauren.
Thanks.
Thank you.
Thanks, everyone.
Bye, everyone.